Today we will discuss acute pancreatitis, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Acute pancreatitis is a sudden inflammation of the pancreas, a gland located behind the stomach and helps with digestion and blood sugar control. Severe abdominal pain. This is one of the first symptoms of acute pancreatitis. It often occurs in the upper abdomen and may radiate to the back. Nausea and vomiting, feeling sick to your stomach and throwing up. Fever, a slight increase in body temperature. Rapid heartbeat, your heart may beat faster than usual. Bloating, a feeling of fullness in the abdomen. How to know if you have it. Pain, if you experience intense abdominal pain, especially after eating. Medical test. Doctors usually perform blood tests to check for elevated levels of certain enzymes and may use imaging tests like an ultrasound or a CT scan to see the pancreas. If you suspect you have acute pancreatitis, it's important to see a healthcare professional immediately as it can be serious. If someone has acute pancreatitis, here's what to do. Seek medical help. Call a doctor or go to the hospital right away. Don't eat or drink. Avoid food and drinks until a doctor says it's okay. Rest. Encourage them to lie down and rest. Pain relief. If safe, over-the-counter pain relievers may help, but follow the doctor's advice. Follow doctor's instructions. They may need tests, medications, or treatment. Always prioritize getting professional medical care. In the hospital, here's what doctors typically do for someone with acute pancreatitis. They administer IV fluids. They give fluids through an IV to keep the person hydrated. Pain management. They provide medications to relieve pain. Nutritional support. They might start with no food or drink and later provide nutrition through an IV or a special diet. Monitoring. They keep a close watch on vital signs and overall condition. Treat underlying causes. If there is a cause like gallstones or alcohol, they may treat that specifically. Medications. They may prescribe other medications to reduce inflammation or treat infections. The goal is to help stabilize the patient and help the pancreas heal. Here are some commonly used medications for acute pancreatitis. Pain relievers such as morphine are often used for severe pain. Hydromorphone, brand name Dilaudid, is another strong pain relief option with a very long half-life, meaning the patient will not need a second dose until many hours later. Antibiotics. If there is an infection, antibiotics like ciprofloxacin or metronidazole, which are two different antibiotic classes, may be considered. Enzyme supplements. If the pancreas isn't producing enough enzymes after recovery, they will give pancrelipase. Proton pump inhibitors, PPI, to reduce stomach acid and help healing, such as omeprazole or lansoprazole. Always follow healthcare providers' specific recommendations for medications. People who are at increased risk of developing acute pancreatitis include heavy drinkers, those who consume a lot of alcohol regularly, gallstone sufferers, people with gallstones which can block the pancreas, obese individuals. Being significantly overweight increases the risk. Smokers. Smoking can harm the pancreas. Older adults. Risk tends to increase with age. People with certain conditions, those with diabetes, high triglycerides, or certain genetic disorders. If someone falls into these categories, they should be mindful of their health and seek regular checkups. Now you need to watch my video on asbestosis or have a look at tracheal stenosis.